You're watching the Wellness Hour, news that makes you healthier. I'm Rrandy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic of dental implants, Dr. Jirik. Dr. Jirik, welcome to the program.
Hi, Randy. It's nice to be here.
Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, who's the typical patient that's coming in for dental implants?
Well, Randy, we have a lot of different types of patients, but most of our patients come in, they're losing their teeth, they've had a lot of dental problems, gum disease, bone loss, decay, things of that nature. They've not been able to see a dentist or been afraid to go see the dentist, and just years of neglect from that. A lot of these patients, they're fearful. They've had a bad experience in the past. They don't want to go to the dentist. But they know one thing, Randy, is they don't want a denture. And it's the last thing they want to go to. They've seen the problems of other patients that are friends and family that have been in dentures, how they've suffered with ill-fitting dentures, not able to eat out, not able to sing in the church choir, whatever. And they don't want that life for themselves. They want something better.
Okay. Now, the second group is what?
Well, a lot of these patients are denture wearers, that they finally have put up with decades of not being able to eat properly, not being able to go out in public and smile and do what they want to do, and they're tired of these ill-fitting dentures and adhesives and things. We have solutions that can take care of that for them, and we can attach that denture and give them a permanent new arch of teeth.
Now, is this true that on the day of the procedure, people could literally walk in that day with no teeth?
Yes.
And walk out with teeth that don't come in and out?
Absolutely.
Is that real?
It's true, Randy. Yeah, they come in.
It happens like rarely?
No, it happens every week up there, multiple times a week. Patients come in, they have bad teeth or no teeth at all. We put them to sleep. We have them in there for the morning. When they leave, they've got a full set of upper, lower, or both upper and lower teeth. They go home, they can chew and eat with that. We tell them to take care, not overdo it, but they can go out and eat what they want. And immediately, they've got relief from those loose, ill-fitting dentures.
So you can eat whatever you want?
Whatever you want. The first 8 weeks, we tell people to take it a little bit easy, but if they want to go out and eat something, they can go out and get something good to eat.
So is this the newest, hottest trend in dentistry?
It is.
Dental implants?
Yes, dental implants it is. It's been around for a long, long time. That's what a lot of people don't understand is that dental implants have been around since the 40s and 50s. And it's recent that people have understood that it's predictable. It's a great way to go instead of dentures or having to go into dentures, that they can go with dental implants and permanent teeth and not have to deal with these loose, ill-fitting dentures.
So you've restricted your practice, I guess, to where this is your focus?
Yes.
Just dental implants?
Just dental implants, cosmetic dentistry, sedation dentistry, but mainly dental implants.
So when people, because you're big on sedation, so people come in?
Yes. Well, most people that come to us, they come in because they're afraid of the dentist. They've had bad experiences as a child or whatever. They don't want to come in. They put it off for years. Most of them are embarrassed or ashamed. And we don't judge. We're just here to offer a second chance for these folks. So we put patients to sleep. I've been doing it for many, many years. We actually have a nurse anesthetist in the clinic that helps us with a lot of these patients. But you come in, you go to sleep.
So when you say sleep, they're basically just sedated?
Yeah, they're sedated. They feel great. They don't have any recollection of anything that occurs during that and during the procedure.
And you do this in one afternoon?
Oh, yes, sir. They come in the morning and they're done by usually 1 or 2 o'clock, and we can do as much dentistry as they need typically in the morning.
Let's talk a little bit about the denture wearers. Are there a lot of denture wearers in Arkansas?
Oh yes, there's so many denture wearers. There's probably close to 1 million denture wearers in the state of Arkansas.
Is that right?
Yeah, there's a lot of folks, and they're suffering with this for years with ill-fitting dentures. They're avoiding foods that they like. They're avoiding social activities like going out to eat with friends and neighbors or singing in the church, and we're able to put an end to that for them with dental implants. We can have the denture snap in, or we can do the new permanent arch of teeth, and it just gives them a whole new lease on life.
If there's close to 1 million people with an upper lower denture in Arkansas, as you say, then why aren't they all doing it? Why aren't they all coming in to do it?
Well,
What's
Randy,
your take?
They've had bad experiences with the dentist before. That's how they got into the denture. They'd go in, they get a tooth removed, they go back, they get a few more removed, they end up in a denture. The dentures didn't fit, they'd go back, they'd get it adjusted, it didn't stay in, they'd use adhesives. They've had a ton of problems. the last thing they want to do is come see another dentist.
Do you hear that, by the way?
Oh, yeah.
Like, no offense, doctor?
Yeah, I wish I had a nickel for every time I've heard. I don't want to be here, and it happens every day, and we understand that. And that's why we don't judge our patients. We bring them in, find out what they want, give them a good solution, and we bring them in, sedate them. They're able to have their work done comfortably, and then go back home and carry on with life. And Randy, back to the original question, why aren't they coming in? So many people think they're too old to do this.
How old can you be?
Well, Randy, I've treated people in their 80s and 90s. I've got one lady that we treated in her 80s, and she's 100 now. So she's had 17 years of use of her dental implants, going on, carrying on, doing what she wants to do, eat what she wants to do.
Well, why would a 90-year-old want to do this?
Well, Randy, they want to eat. They want to be able to enjoy themselves. They want to go out and socialize.
Fair.
So, there's lots of reasons to do this.
Now, but isn't it true, if you've been wearing a denture for, let's say, 20 years, you don't have enough bone to do this?
No, Randy, that's absolutely not right. Patients come in all the time that've been told other places, oh, you don't have enough bone. We've got a cone beam CT scanner in the clinic. We can scan, we can see exactly what's available for those patients. We have solutions for every patient today.
Have you ever had to turn anybody away because they don't have enough bone?
No, we do not. We do not. We're able to give a patient an implant solution no matter what condition they come in.
Now, at your practice, I guess how dental implants are normally done, you go to one doctor that does a surgery. You go to another doctor that puts a tooth on top, I guess somewhere else for the imaging. You do it all right there. Now, aside from convenience, what's the big benefit?
Well, Randy, convenience is a big deal. And, these patients, when they go to these multiple dentists, a lot of times they don't know what the final outcome is going to be. They don't know what their final cost is going to be. They come to one convenient clinic. We're able to give them the cost that day, what they expect, how long they're going to be in treatment, and how long it's going to be before they get their new teeth. We're able to do all that in one place. And Randy, the other thing is I'm a cosmetic dentist. I've been doing cosmetic dentistry for decades. So when a patient comes in with the denture, usually their face, their smiles, it's sunk in, they've lost a dimension in their smile, they're overclosed. They really need a complete overhaul. So we're able to come in and give them a new set of teeth attached to the dental implants, and we're able to fill out their face. We're able to give them nice, pretty, aesthetic teeth.
So they look real.
They look real. And that's the funny thing. For years, I've had print media advertisement. People come back, oh, I want this smile. And I laugh because that's a denture patient half the time. And people come in with real teeth and they want the denture patient to smile. Happens every week.
Now, we should mention that as far as the dental implants, Medicare, Medicaid does not cover it. Even the best dental insurance only covers a very small portion. Is that right?
That's right, Randy. But, patients finance this every week up in our clinic. We have a staff member or staff dedicated to helping patients to maximize their dental insurance benefits that they have and then finance the rest. If you've got decent credit, we can get you financing.
Is that right? So people are financing this all the time?
All the time. Absolutely.
Is this one of those things where people say, I should have done this years ago?
Oh, we hear it all the time. We had one patient that had been with us forever, and I kept telling her, you really should let us put dental implants down here to fix this and remove your partial. And we didn't do it. And when she did, she was so happy. She was almost mad at me for not forcing her hand at doing this.
Are you ever in that position? Because you said, we've talked in the green room, you've made hundreds and hundreds of dentures over the years.
Well, yeah, we've made hundreds of dentures over the years, and you try to tell patients that there's a better way of life here, and it is kind of disappointing or frustrating that that there's something that's so much better for them out there available with dental implants and full fixed teeth, attached teeth, and they don't do it. But when they finally do, it's really rewarding to see their reaction.
What do they say?
They're so thankful, and they're so happy, and why did I do this sooner? That's what we hear all the time.
Okay, now you brought photos. What are we looking at?
Well, this first one's Margaret. Margaret came to us, and she was one of 12 kids. 12 kids. And her dad was a military man, so they traveled a lot. She had an accident, broke her front teeth when she was very young, and for years she ran around with a bad smile, hiding her smile, ashamed of her smile.
So that's her smiling right there?
That's her smiling, yes, right there. And over the years, she developed gum disease, bone loss, tooth decay, had a lot of dental problems. And, she was working in the public. She couldn't smile. People probably thought she was grumpy, because that's her smile. So her options at this point are she can go into a full denture, upper and lower denture, and suffer with that. Or she can have dental implants and full arch of teeth attached to that. And, it's awesome when we get folks like this because, we know what's going to happen. We know where they're going to end up. And they're going to get this great smile. They're going to be able to eat and chew. They're going to get their self-confidence back. They're going to feel good about themselves.
So on that consult, when they tell you their story, do you ever in your mind go, boy, this is going to be good?
Oh, yeah. And she was one of them. Her case just turned out awesome. She's got a great smile.
What'd you do for her?
We gave her a full set of teeth, top and bottom, one visit.
That don't come in and out?
They don't come in and out.
Let's take a look.
Right here, Randy. When she picked up the mirror afterwards and saw what she looked like afterwards, there were tears of joy in her face. She was so happy that after years of not being proud of her smile, not having a beautiful smile, that now she's got this beautiful smile.
She looks different. And I'm not trying to side with you, by the way, but anybody at home watching this can see she looks different.
I mean, she looks different. She looks younger. She looks happier. She looks healthier. And look at her hair. Look at her eyes. I mean, her eyes are smiling. Look at her before. She's not happy.
She looks a little older in the before.
She looks older,
frankly.
absolutely, I think. Absolutely. So we're able to take some years off, give you your self-confidence back, and get you back into the game where you can chew and eat whatever you want and not be afraid of going out to eat. That was one of her biggest complaints. She wanted to be able to go out and eat anything on the menu.
So she could eat salads, whatever. Doesn't matter.
Peanuts, carrots, pizza, chicken,
even
anything.
Biting like a raw carrot with her front teeth, that's okay?
Yes,
once she's healed up?
That's okay. That's
really?
Okay. Yeah, absolutely. You can go back to vegetables, a healthier diet, healthier lifestyle. Eat whatever you want to eat with this.
Do you hear eating stories all the time?
And one of my favorites was an older patient that I had years ago. She owned one of the drive-ins in town, and she said, I can't wait to eat a dill pickle again. And we got finished with her cases. Before we did permanent teeth like this, they were just a snap-in, snap-out teeth at that time. She came back in so happy because she could finally eat a pickle again.
Is that right?
Yeah.
So one of the options is a snap-in, snap-out set of teeth.
We've been doing snap-in, snap-out teeth for decades. That was the mainstay to go to. And the new wave with permanently attached teeth is kind of like a Ferrari and a Cadillac. I mean, they both are good options. Some of our patients do stay with snap-in, snap-out teeth. They only come out when you pull them out.
Okay.
And the reason is that it's easier to clean, easier to take care of. Some of our patients need that. Other patients, they're able to clean it, they're able to take care of it. We go to the permanent teeth, they don't ever have to worry about them coming out, and we show them how to take care of it, and we help them take care of that.
Now, so once it's done, they're like back in the dental system, like every 6 months they get a cleaning?
Every 6 months, and that's the neat thing about our office, that we offer a full service clinic. Not only are we there to help you put your dental implants in and give you your smile back, but we're there to help you take care of them and service it. We have a great hygiene staff. They've been doing this for decades. They know what to look for. I come in, check on you every 6 months, every year, whatever, and make sure that you're doing well. We want you to maintain your investment here. We look forward to seeing, I get to see my friends every year, for years.
So no more dentures?
No more dentures.
You think you can wipe them out in your town?
Well,
you're in a small town, right?
I'm in a small town, but we treat people from all over the state. It's not unusual to have people drive in 2-3 hours coming in to have treatment done because they've heard about us. They've heard that.
Because you do a lot of advertising, things like that.
We've been doing advertising for years. We're trying to put out the good word about dental implants and attached teeth. There's so many people that are suffering with bad teeth, bad smile. They're not able to chew. They're not able to eat. They have denture sores. And we can eliminate that with these options of attached teeth.
Quickly, in one day. That's not just lip service, you can do it?
It's not lip service. We do it every week at the clinic.
Is that
one
right?
day, yes, sir.
Okay. Now, you have more photos, but we're gonna take a quick break. We come back, more about the process and some more of the before and after photos. You're watching The Wellness Hour. I'm Rrandy Alvarez. We'll be right back.
I'm Paula Hampton. I'm from Cabot, Arkansas, and I've been going to Dr. Jirik for over 10 years. Basically, I had implants. It was scary at first, but as he walked me through the process and talked to me about the process and each individual step I was going to take, it was the information I got, and I felt like it was exactly how it was going to happen. So I felt very safe and secure, and knowing that I was going to get this taken care of and that there was a light at the end of the tunnel, that was the most important thing to me. I just wanted to be able to smile, and now I can with confidence. And that's an amazing part of my life that has changed.
I'm Greg Watton. I'm from Cabot, Arkansas, and I went and saw Dr. Jirik in December of 2014. Well, back in my school days, I played the trumpet, and that was 40 years ago when I graduated. And I quit playing the trumpet because of my teeth. So after I got my dental implants, I asked Dr. Jirik, I said, would it be okay if I started playing the trumpet again? And he said, sure. So I picked it up, and it wasn't but a couple of months I was back to playing again. It just makes you feel better. It makes you feel better about yourself. And you don't mind showing that pretty white smile that you've got now.
You're watching the Wellness Hour, news that makes you healthier. I'm Rrandy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says you can, on the day of the procedure, you can walk in without teeth and walk out with a full arch of teeth on the upper and lower that don't come in and out, eat whatever you want. We're talking about dental implants today with Arkansas's dental implant dentist, Dr. Jirik. Dr. Jirik, welcome back to the program.
Hey, Randy, it's great to be here.
Now, I know you brought a lot of photos, but we were talking in the green room earlier that people with bad teeth are judged. Elaborate on that.
Absolutely, they're judged. You know, for years, if someone wanted to make you look dumb in the movies, what do? They give you bad teeth, they have one that's missing. And so, you know, patients that are folks that are out in the public eye, their teeth affect how they're viewed by the public. And we see that all the time here at home. So let's say you're applying for a job. One guy's got a great smile, the other guy doesn't. One guy smiles during his interview, the other guy doesn't. Who's going to get the job?
It's not necessarily you hire the one with the prettier smile, but if one is smiling and one isn't,
you get the better attitude if you're smiling. You know?
Okay.
And you feel better about yourself, people feel better about you.
Well, you're a dentist, so you probably think that the smile's like the most important thing.
Well, it's very important. You know, it frames how people perceive you in public. So, you know, you come in and you don't have a great smile, you don't have a good attitude, they're just going to think maybe you're checked out or that you're not involved or you're not happy. And so with a great smile and being involved, people see that and they feel that, and you know, they feel better about you. So, you know, Randy, in life, if you don't like something about yourself, you're too big, you lose some weight. You don't like your hair, you get a hair transplant. You don't like your smile, get your smile done. We've seen so many people that, you know, they come in, they're not happy with their smile. It's holding them back, and they're not happy with it. They come in, whether it's a smile makeover or fixed new teeth on dental implants, it changes their life. You know, they're able to go out with their family, have dinner, they can go out with their friends, do whatever they want, go to dinner, go to church, sing in the choir. Heck, I got one guy, he plays the trumpet now. He couldn't play trumpet for years. He lost his teeth. We were able to fix his teeth for him, give his teeth back, his smile back. And after a few weeks, he took up trumpet. He's playing trumpet again.
Is that right? Good. Then you brought photos.
Yes, I did. This is Danny.
Oh, boy.
Danny's a great guy. Love Danny.
That's got to be unusual.
No, we see it all the time. You know, and that's what Danny said. He said, Doc, I'm embarrassed to come in like this. And I said, why, Danny? He says, because I know you've never seen anything this bad before. I'm like, Danny, I see this all the time up here. And he'd worked for 35 years in the school district.
This is common? I never see this.
Oh, well, they're not smiling, Randy. Yeah, if
Okay,
you had
good point.
this,
So they're hiding it.
they're hiding it, and they're masters at hiding it. For whatever, they look down during a photo, they smile with their lips closed together. You know, they're masters at hiding this. They spent their whole lifetime hiding this.
So when he comes in, and I'm sorry for interrupting you, but
okay.
he comes in, what does a guy like that say? Like, what are his goals?
Well, he just wanted to get his smile back. He wanted to be a little healthier, and he wanted to be able to eat. You know, he'd had problems eating, and he was starting to have pain and bleeding of his gums, and, you know, he was in trouble.
So you could not save those teeth?
No, those teeth were hopeless. They were absolutely helpless. But as bad as those teeth were, Randy, he didn't want to go to denture. He had friends, family had been in dentures, and he saw the misery that they were in.
Like, no way a denture.
No way was he going into denture. So that's what's awesome about what we're able to do for him. We're able to bring him in, let him sedate him, and in one visit, we were able to get all those bad teeth out, get his new smile back in.
Let's take a look at that.
There he is.
Wow.
He hadn't even learned how to smile yet. You know, that's what's funny, Randy. They've been hiding it for so long, it takes them a while before they could really get a good smile. And he's doing a good attempt there, but I mean, it'll be bigger in a few more weeks or months and all. But back to Danny, it was awesome because we're able to get all this stuff done for him. And now he and his wife both, they're going out, they're doing things, and everybody's commenting about his smile, and he loves it. He's so happy, and he's done some testimonials for us. I mean, he's very proud of what's happened here, and he's a hardworking guy. He took care of his family for years, in the school district for years, and it's finally time that he took care of himself. So the great thing about Danny is he was in pain. He hurt, he couldn't eat, he couldn't chew. He just wanted to be fixed, okay? But the cool thing about it was, and what's so cool about this was, he's got a great smile. He's really into his smile now. He's proud of his smile, and people ask him where to get his teeth done, or
they probably say, for your age, you have great teeth.
He said, you've got great teeth, and he's very proud of that fact. And he's forgotten about how he hurt and how he suffered before, and he's looking forward to how he's got a great smile and a great outlook on life.
So some people come in because they want a better looking teeth, better looking smile. Some people come in because they want to eat better.
Yes.
What do they enjoy the most, the eating or the smile?
I think a little bit of both, but probably the smile.
Is that right?
They won't tell you that, but I think they're really proud of their new smiles. And that's the fun part about doing this, because they come in like this, and as a cosmetic guy, I know we're going to be able to knock this out of the park for them. We've got a great lab. We use some of the best teeth in all our setups like this. We're able to make everything look natural, give them a little bit brighter smile, fill out their face, take years off. It's wonderful, very rewarding.
You have more photos.
Yes, I do. This is great. This is Steve. Steve's a musician, and he's a guitar instructor in Little Rock. And he's a great guy, but Steve lost his smile over the years. He had dental problems. He was losing his teeth, and he had family that had been in dentures, and he didn't want to go there.
Didn't want dentures.
Didn't want dentures, not at all. So he came in, and we did our typical deal. We brought him in, we sedated him, and one morning we were able to take out all his bad teeth, and we were able to attach upper and lower teeth, and he was able to go out after just a few days of recovery and go back to
very nice.
Being a musician, absolutely. And instead of hiding his smile, now he's got something he can flash while he's singing.
Okay, good. Time for a few more.
Okay, this is a great guy. Speaking of Arkansas, this is one of my East Arkansas guys, Rrandy. He's a farmer and a businessman. Rrandy, for years, has taken care of his business, his family, been involved in his community, and he got in trouble. He didn't have time to go to the dentist. Smart guy, hard worker, but he just didn't have time to make it there. He ended up in trouble. His family had been to see us, and he came in on a referral and needed some teeth fixed. So we were able to.
So you couldn't save those teeth?
We couldn't save his upper teeth. We were able to save his lower teeth. So we did permanent implants and our permanent teeth on the top, and we were able to do crowns on the bottom. So it's not a one size fits all. Not everybody looks. Look at that smile.
Oh, that's nice.
Isn't that great? Okay. So he's got a smile he can be proud of now. And, he can go out and eat whatever he wants to. So, guys like this, they want to go out and get a good steak, and they can go in and they bite in that juicy steak. Look, we have catfish in Arkansas,
Okay.
All right. And so, we can do that. And it's just really great that he can go out and eat what he wants to and not have to worry about it.
So like most of these people, they go in, they're IV sedated, they're numbed up, they wake up and they have their teeth.
They wake up, they have their teeth, and they're able to go back, go home, rest a few days, and then go about their normal activity. And there's very little pain associated with this. Patients come back and normally they haven't taken their full prescription of pain meds, but we're there for them when we tell them what they need to do and how to take care of all this.
Okay, good. You have more photos?
Yes, I do.
I don't want to rush you, but we only have time for a couple more at the most.
This is one of my younger patients. This is Eric. This is a great story. Eric worked at a fast food restaurant for years. And, what do you have fast food? Cokes, things like that. So he was drinking soft drinks all the time. Eric one day woke up and realized he was in trouble. He had tons of decay on his upper teeth. He came to us and, he was too young for a denture, didn't want to go through that. And we weren't able to save those upper teeth. We knew that, but we were able to save his lower teeth. So
a guy like this, that young, would have had a denture?
A guy like this would have had it. Right? The patients that I see in their 60s, 70s, and 80s, they've been wearing dentures 20, 30, 40 years, 50 years. So yeah, it's not uncommon, even today, for patients this young.
Let's take a look at that after. Oh,
Look
my
at that
goodness.
smile.
Beautiful.
You know what's so great about Eric?
And that's changed everything with this guy.
Well, yeah, it's changed everything. He's got another job. He's doing well in his career. He's married now. So, Eric got his smile back. He's got his life back. He's got his self-esteem back. He can be proud of himself. And, he's a very marketable commodity there. This is my favorite one. I saved this for last.
All right, save this one for last.
So you asked me earlier, how old are you? How old is your oldest patient? And I said, I've got a patient 100. Well, that's Miss Shelley.
She's 100 years old in this
She's
photo?
100, but she came to me 83 years young. For the last 17 years, she's been in, she's had her teeth on her implant, snap in, snap out, and she's happy. She can sing in the church choir, she can go to social events, eat whatever she wants. Think about, she was 83 when she got done. How many years did she suffer needlessly with bad, ill-fitting teeth?
So probably from her 60s to 83, bad teeth.
At least.
Well, at least at the end, she got great teeth.
She got great teeth, got a great smile, and I get a hug every 6 months, and it's awesome.
Is that right? Now, they look good.
She looks awesome.
So 80
Everybody
is young in your office to get this done.
80 is
70 is really young, I guess, to get this done.
Yes.
So age is not an issue
It's not an issue.
statistically?
No. What you should do is you should really get this done while you're healthy enough to get it done so that you can eat the foods that are good for you, take care of yourself, and live a happy, healthy rest of your life.
I know I wanted to ask you this. What if you have bad gums, like gum disease? And that's why you lose your teeth, because of the bad gums. Can you still do this?
Oh, absolutely, Randy. I mean, we want to get you in while you got bad gums, and we want to be able to examine that, see how far gone it is. If we can save your teeth, absolutely we want to do it. But a lot of people, it's too late. We're able
So you
to
clean
offer-
up the gums.
We can clean up the gums, take care of that. A number of patients, we've saved their teeth. But if you can't, you don't have to go into the dentures. You don't have to go into partials. You don't have to suffer. We have a great solution with the teeth that we do on the dental implants.
Okay, good. Now, for people watching this, final question. They're either headed for dentures, bad teeth, or they're already wearing a denture, but for whatever reason, they've heard what you had to say, but they're still afraid or putting it off. They're too busy. They've got every excuse. What do you say to them?
Randy, we see that every day. We don't judge at the clinic. We're just here to give you a second chance. The patients that are afraid, we're able to sedate you. You're not going to remember a thing. During your procedure, you'll be out. When we're done, we're going to get you back up and at it.
Okay.
Do what you need to do.
So start with a consultation. Free consultation?
Free consultation, Randy.
Do they get to see you?
Yes, they see me. We'll do a full examination have a CT in clinic. We'll do a cone beam CT. I can see all the bone that's available. We can do a thorough examination. We'll give you a treatment plan of your total cost that day. Yeah, you'll know when you walk out. A lot of times our patients do records that day. We get started that day.
And you show them financing payments as well.
Financing
all
payments,
right there.
all right there. Yes,
Okay,
sir.
good. I want to thank you for coming on the show. Good stuff.
Okay,
Appreciate
thank you,
it.
Randy. Appreciate you for having me.
You've been watching The Wellness Hour. I'm Rrandy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Rrandy Alvarez, the authority on health issues.